all these medications managed when you are in cardiac rehab?
So what happens in cardiac rehab also is that the patients will get evaluated and treated by the nursing staff and the exercise physiologist. And when I mean evaluated and treated, if there's any issue with their medications or their blood pressure during exercise or their blood sugars, because we check that regularly as well, or we see that their weights are not at goal, we have nutritionists that are available on staff to help. We contact their physicians, of course, if it's anything significant or serious, including whether they've had issues with their blood pressure, issues with their sugar, or particularly issues with arrhythmias. But one of the goals of cardiac rehab is to go through and make sure they're on these medications. Anti-platelets help allow the blood to flow a little bit easier and it may be necessary particularly after a stent.
Right.
Beta blockers help with the heart because they help the heart work less and lower the blood pressure. ACE inhibitors also can do the same and are particularly helpful in diabetics. And statin medications we talked about, they help prevent plaque progression. They also have some anti-inflammatory properties, which also has been implicated in the process of atherosclerotic disease. So a lot of these put together are very helpful for the patients because not only do they prevent progression, but a lot of these have been shown to help increase survival of the patients. They have other benefits for their blood pressure, for their kidney function, and for their sugar control. So a lot of this stuff we need to kind of monitor, and the exercise physiologists, the nurses, staff at cardiac rehab kind of help oversee this to give feedback back to their referring physicians, because in particular with exercise, we see all these factors and how they play.
Now, before we go to break, I do want to ask, because you did talk about lowering your sugar levels as well, your glucose levels. So what if you you're diabetic and you're in cardiac rehab? So
Right.
how do you manage your numbers there?
So we check the numbers regularly with cardiac rehab, and if there's any discrepancies, we certainly won't manage the patient's medications, but we will refer if we see trends and if we see that their numbers are high. We make sure we have contact information for the referring doctors, and we make sure they're contacted to say, you know, you need to get back to your cardiologist, your endocrinologist. We need to get these things in order for you because, you know, again, it's not just come here to exercise, it's come here to change your lifestyle and make sure that you're on the right track back to good cardiac health.
Right.